I have been diagnosed paranoid schizophrenic since I was a child, early diagnosis, and my father passed away and I moved to Colorado. My mother passes away 3 years later and then moved back to Georgia. And everything started weighing on me a little bit. I wouldn't be here sitting in this chair if it wasn't for Advantage, because my mental health was going downhill extremely from depression. I haven't been depressed since I've been here.
Typically, the client who comes to Advantage is the underinsured or the uninsured.
CCBHC stands for Certified Community Behavioral Health Clinic, and it is a comprehensive approach to behavioral health care.
As we've gone down this journey of CCBHC, we are able to give our clients services that a local nonprofit behavioral health agency is not able to do.
In the CCBHC model, there are 9 specific types of treatment that are expected, and what that means compared to now is that there's going to be an expansion of services.
So having a CCBHC allows us to provide services in a way that looks at the whole human being and what their needs are and tries to meet those needs, for that client on that day.
We've had individuals who come to Advantage and they have never seen a primary care doctor for years. And they come in with different health conditions and there's nowhere to send them because they have no insurance. So this way, those individuals, we can walk them down the hall and they can see a primary care provider.
We have a nurse practitioner who would see clients for lower level healthcare needs. And so it will decrease them from running back and forth to the ER.
Everything's here. You go see the doctor, you go see your therapist, you go and fill your scripts right there.
There's not a light switch that you flip on and a provider is suddenly a CCBHC. You can think of this certification process as 3 steps. The first is really readiness and investment, the beginning of the process. About a year into that, there is an attestation that takes place that sort of kicks off stage 2 of the process. And then step 3 would be certification by DBHDD.
I think for us, what's going to be the big difference is the way we're funded. That's huge because right now we get reimbursed with Medicaid, which the rates have not been adjusted for a couple of decades.
CCBHCs not only create new positions, they also reduce turnover.
With the CCBHC model, we will be able to actually cover our costs, which will benefit our clients because we can expand our services, we can offer competitive rates to our clinicians, and we can have that level of services that the client needs. For example, care coordinators are not covered under the current model of funding.
The care coordinators are a huge part of the client success because I have 3 care coordinators and we're calling clients on a daily basis to check in on them. We see that you missed your appointment. Can we get you rescheduled?
We currently have 11 CCBHC candidates. If you think of it in stages of readiness, we have 7 that are just starting out in the beginning, and we have 4 that are in stage 2, and we are working towards certification. Our hope in NAT accreditation is that anyone who walks through the door, if they have a behavioral health diagnosis alone or a behavioral health diagnosis with a developmental disability, will be served confidently and with care.
We still have a long way to go with addressing the stigma to behavioral health, but I think this has opened a lot of people's eyes. They're ready to talk about and ready to listen.
CCBHC is a step towards value-based care, and what that means is that we're measuring many quality measures and outcomes that help continuously improve and drive service delivery.
Used to be we could just say, we don't know, this is how many clients we serve, but now we can say, this is how many clients are better because of the services that we are providing.
And what we want is for people to have treatment that works for them and sets them on a path of recovery for their whole life. So we're not just focused on one particular need that they might present with, we're looking at the whole person and trying to meet their needs across their lifespan.
I'm all for it. I think there should be one. I think there should be one in every city. The nuts and bolts is that there has to be more places like this. For a crisis center in one spot, a pharmacy in one spot, a doctor in one spot, a psychiatrist in one spot, a therapist in one spot. You can't get any better than that.